Hi everyone, this is Ash, and one of the topics that often surface up among my friends and many others is about cognitive impairment, especially when related to depression, when related to schizophrenia, related to schizoaffective disorder. This is a very complex topic, and it interacts and integrates with a lot of other things. Why do these things happen? The way I personally understood it. Now, this is something you won't find in science journals yet. It has not been put into scientific documents yet. So, asking doctor about this won't help because doctors don't have proof for this unless there are a lot of patients who can observe and can confirm and talk to doctors. This won't get documented or researched. So I'm putting my foot forward, best foot forward, because I've experienced it in my life and I'm able to work around it, this issue. Not that I don't have any problems. I do have some level of cognitive impairment, but it does not hamper my work. I'm able to remember things, I'm able to think. How do I do that? I put in a lot of work. Put in a lot of work from what I have explored and discovered for myself. Few points. What happens to our mind when we have schizophrenia or schizoaffective disorder? Now, let me explain it this way. This is a train of thought, and this is delusion, a parallel train of thought that warps around your original thought. So, let's assume that delusion and the hyperactivity of psychosis before it erupts at the surface is already going on within, underneath, with every thought. Sorry for my shaking video, I've got a little bit of shaky hands, so I hope you don't mind that. So imagine that there's a thought and there's a warp, psychosis, and from different directions there are a lot of thoughts, that stream of thoughts that come in and influence the thought and warps. This is the central thought that I've come up with, the cause of what happens in schizophrenia and why it happens. The work that I put in is to relax, observe, and keep my thoughts clear of these warped parallel thoughts. Doing that makes my mind able to separate and clear faster. Doing this day after day for years, you sort of form a discipline. You can know when something is going straight or something is warped. When it's warped, you take a break, you take two steps back, you relax, let it settle down, and then you return to it. Now, a lot of students may have to be very patient. A lot of professionals, you may want everything instant, results instant. My thoughts should work in an organized way, but disorganized thinking, which is caused by the underlying psychotic or delusion like or hallucination like thoughts that flow along with the original thought, is the cause of disorganized thinking. And that's the nature of the illness. And it is what causes delay, it is what causes cognitive impairment, and there is no steady treatment for it. You cannot treat it with medicines, you cannot do that. As far as I know, unless they come up with something, but I think the best solution for it is to actually relax and to be able to return to the original flow of thoughts, or to be able to manage the warp. Take a time out, take 5 minutes, 15 minutes, let the warp settle, and then you go, and your recovery is much faster coming back into the original train of thought. And I want to make this video especially for my friends and for everyone who keep asking me, what is the treatment, how do you cope with cognitive impairment? There is no treatment for it, except if you form some discipline, or maybe somebody develops a therapy for it where you can learn to relax the warp warped thoughts that go along with the mind, and the mind can work smoothly. With practice, I know that over the years I've been doing it, I can do it much faster. But it's very hard to explain, very hard to teach someone how to do it. You have to explore, you have to experiment, you have to learn. Just eating foods, eating vitamins, or having substance that will force the mind forward is not going to help, because the mind itself is enveloped by the warp. I'm sorry again for the shaky video. I hope my video sends the message across, and I hope that a lot of people will realize, and I hope that the world will come up with some therapy for this. Therapy might be a better way than medicines for this, but I don't know what kind of therapy. Maybe DBT may help to some extent. Mindfulness, maybe. It helped me. So I wish you all the best, and life is life. We carry on, we do our thing, and we hope for the best. Thank you for watching.